one of our patients. And what was your name?
Lester Lackey.
Hey Lester, thank you for talking to us today. And what kind of problems were you dealing with that had you seek out medical attention?
Neuropathy.
Neuropathy. And did you go anywhere else before you came to see Dr. Shook?
Yes, I've checked with 3 different doctors over the past 10 years, and all of them told me the same. There was nothing could be done except take pain medication.
Okay, yeah. So what was it that we did here in our office that helped you?
Well, I heard about Dr. Shook, and I come over here and discussed it with him. And he said there was no guarantee he could help me, but he said there was a pretty good chance he could. He'd help me.
Yeah.
And I started taking the treatments. I started seeing a great improvement.
Oh, that's wonderful. And so how are you feeling now? Do you feel like it's benefited you still in the long run? Okay.
Yes,
wonderful. Well, thank you so much for talking to us today.
You're quite welcome.
Hi, I'm Dr. Shook. If you have been told that there's nothing that you can do about your peripheral neuropathy, your numbness, tingling, burning, if you're having any of those sensations, then I'm here to tell you that there is hope and that there is science and evidence that you can improve those symptoms and you can do it naturally. You can listen to some of my patients and their experience with this, but I'm here to tell you that the contemporary literature, the science, shows us, we know that there are ways to improve many types of peripheral neuropathy. And I say that because there are numerous types. Diabetes is the most common cause of peripheral neuropathy. Now in my clinic, what we do is we look at you 3 ways. We look at you from an orthopedic perspective to determine if there's anything that's causing compression, entrapment, or injuring or damaging the nerve itself that would be causing those sensations. Secondly, we look at you from a metabolic perspective, and we look at your internal biochemistry. And what I do is I don't take the same approach that you get everywhere else you go. What I do is I use a branch of medicine that I'm trained in called functional diagnostic medicine. Now here's the thing, functional medicine seeks to identify the drivers, the causes of the disease process, and helps you to work to reverse it naturally with diet, lifestyle, and temporary nutraceutical supplementation if appropriate. That is the only way that you can get true health back. You cannot medicate these problems and expect to gain health. You have to address what's causing the problem. I'm not saying that the medications aren't beneficial because they help a lot of people manage pain. But here's the thing, if you want to be truly healthy, you have to ask the question and answer, why am I having the problems that I'm having? That's how you get the body in a condition and state to optimally heal. The third thing that we look at and that we do in my clinic is we look at you from a neurological perspective. So we look at the nerves, we look at the types of nerve loss, and then we apply to your condition specific therapies that are evidence-based to improve the pathology itself of neuropathy. Now typically with neuropathy you have collapse of these small capillaries that supply oxygen and nutrients to the tiny nerves in the feet. This is if you have small fiber neuropathy, which is the most common with diabetic neuropathy. It's the stocking and glove presentation where it starts in your toes and works its way up the leg, and then it goes into the hands and it works its way up the arm. That's the most common presentation. There are other patterns with diabetic neuropathy. We work with a number of different types. We apply the latest therapies and technology to help you with neuropathy. And these are evidence-based. I have a stack of research. I mean, there's a few hundred pages of the different types of therapies that we apply. So I'm here to tell you that there's hope. That if you've been told there's nothing that can be done, that is not true. That is just not true. Your doctors mean well, but they don't know the latest science. And if they're adamant, they just don't know the latest science and literature on this. You can go to our website and you can learn more about the approach that I take to helping people with peripheral neuropathy. I really appreciate you taking time from your day to learn more about your health. It is this is such a major problem at epidemic levels in our country. It is not fair to people to not know the truth about these types of problems because there are options, there are things that can help, and my patients are a testament to that.
My name is Kat. I had severe pain in my feet and lower legs. I tried prescription drugs, no results. Came to Dr. Brad Shook about a month ago, and he started a treatment program which included peripheral nerve rehabilitation, LED laser, infrared therapy in both my feet, oxygen therapy, vibration plate balance training. I was so thrilled at the difference it had made. Pain was diminishing, my head feeling returning to my feet, and I can just say thanks to Dr. Brad Shook and his team, because I feel great.
You may be wondering, how do we get the results that we've gotten with these patients? What I want you to see next are a few of the therapies that we can use in the office, or that in certain circumstances, in certain cases, we can set you up with at your home. And because we work with a number of people around the country doing telemedicine from a distance, because not everyone is close enough to us geographically to come in and undergo the treatment that we have in the office. So there are things that we can do from distance, and I want to share some of those with you now. I'm Dr. Shook. I appreciate you taking time from your day to learn more about your health. If there's anything that we can do for you, just let us know. Thank you.